New tonight, Buncombe County officials have extended the Stay Home, Stay Safe declaration indefinitely with a new order announced today. News 13's Caitlin Pinter joins us live with the details. Caitlin?
County officials say that this new order is very similar to the old one. They also say it aligns with the state's stay-home order, except for three key differences. The state's order deems essential businesses essential if they can practice social distancing. They say that's not the case for Buncombe County. The only businesses deemed essential are the ones outlined in the county's declaration. Another way Buncombe County is different is that they prohibit all public or private gatherings of any number of people, except when it comes to these certain exceptions.
For Buncombe County, weddings and funerals are permitted, but may include no more than 10 persons.
Buncombe County has also told all hotels, motels, beds and breakfasts, short-term rentals less than 30 days, homestays and campgrounds to cancel all currently scheduled leisure travel reservations and refrain from scheduling any future runs for as long as the governor's emergency order is in effect.
If you want to get to pre-coronavirus, that might not ever happen in the sense of the fact that the threat is there.
Dr. Anthony Fauci warning life may never return to the normal we knew before the coronavirus outbreak. The pandemic, the reason Palm Beach County schools are forced to cancel graduation ceremonies at the South Florida Fairgrounds.
And Dr. Fauci also says things will gradually come back to where we can function normally as a society again, but in one way or another, the virus will always still be there in some form as a looming threat. CBS 12's Lily Ortiz now on a doctor who says we can slowly transition our lives back to a more typical pattern soon.
An infectious disease doctor says that some cities and counties will recover sooner than others and that there are a few goals that they should meet before cutting back on restrictions. Life as we know it has changed and come to a screeching halt nationwide. Public places closing down, large gatherings canceled, and people forced to stay at home.
Show how nice you walk.
Like many of us, Joe Bizignano wants to know when things will return to normal. He wants to take his wife out to dinner and hug his granddaughter.
And I don't know what to do when I see the baby and she comes, our 2-year-old comes running up and puts her arms around me. I don't know what to do. You know, go to sanitizer and put...
Although no one knows exactly how long we have to wait, infectious disease Dr. Kim Neo says certain steps should be taken before restrictions are lifted. First, tests must be available to everyone showing symptoms.
Hopefully, it'll be done in a rapid enough time that we can make quick medical decisions based on those results. And that's the first thing. I would say the second thing would be the medical capacity. Where do those patients go? And if they're sick enough and they have to go to the hospital, do we have enough hospital beds?
Next, monitoring survivors to make sure they're isolated and staying well. And lastly, he says there must be a sustained drop in cases for at least 2 weeks.
As we test more, we'll have more information to safely say, oh, you know what? Our numbers are finally cresting, they're finally leveling off. And once that happens, then hopefully we can start to breathe a sigh of relief.
A sigh of relief many in this neighborhood are waiting to let out.
We would like to go back to our routines. Definitely beach. I love to go there.
Oh, yeah, you miss not going out to eat. I mean, I also miss not getting together because you can't.
And if there's any silver lining here, the doctor says is that we can help speed up the process by keeping our hands clean, follow social distancing guidelines, and just stay calm.
Buncombe County officials are using what's unfolding in hard-hit cities like New York as an indicator to what could happen here in western North Carolina.
AB Tech's done a phenomenal job in doing just-in-time training for our emergency medical response team.
Emergency Services Director Taylor Jones says about 30 county workers have been repurposed, trained on how to drive ambulances and given emergency medical responders training.
Because we're going to need minute men and minute women when this thing peaks on us.
The county is looking at 2 major prediction models that determine North Carolina's peak phase. County Emergency Preparedness Director Fletcher Tove says the models are similar, but have different estimations of when North Carolina will enter its peak phase based on physical distancing policies across the state.
The medical health metrics and evaluation model predicts that maybe as early as April 13th, North Carolina will enter its peak phase, whereas the RTI International model, which was just released this week, says that we may be looking at peak phase starting mid-May to late May.
Jones says the county is looking at setting up a hospital at UNCA Sherrill Center to care for both COVID and non-COVID patients while leaning on AB Tech to train workers to staff the location.
But as we've seen in other hospitals, when they reach that peak, if we can decompress all their healthy patients out of that, that allows more room for acute care and for patients that need ventilators and specialized care.
Jones says the county is also preparing for a large number of deaths.
We've obtained 3 trailers, refrigerator trailers. We're working with the state and putting together a mass fatality plan that has unified efforts of our whole region.